we have now tafamidis in treatment of amyloidosis, those who are refractory heart failure. And this drug has shown some positive results. But these are very small number of patients, not large number of patients. So we can't be generalizing this at this moment. And these are very costly drugs. So maybe therapy cost would be something like 1 lakh per month. So that is the problem. And amyloid cardiomyopathy is also diagnosed very less often in India. And but this is good thing that we are getting some drugs for these indications. Dr. Nishant, have you come across any patient with cardiac amyloidosis, TTR type?
So here in Gangaram, they are doing this study, and there's a doctor. He has given me his number, so he is following up this patient. There are only 24 patients, and to differentiate the type of amyloidosis, and they are giving this therapy. So they are doing it as a trial and asking for referral from all over Delhi, because these patients are very rare, and in years' time, you find 1 or 2 patients of amyloidosis. So
The
one
drug is
center
given
I
for
know of,
free. The drug is given for free from the company, or they are buying?
they are giving it as a trial. All the
Okay.
investigations are free, and the drug is also.
Very good. So we can go to the next presentation.
Yeah, I just make one comment on the diagnosis of cardiac amyloidosis. Moment you have a interested cardiologist in amyloidosis of the heart, their diagnosis becomes very rampant. So we have a cardiologist whose radiologist turned into specifically into cardiac MRI at Jupiter Hospital in Mumbai. She has become really good at diagnosing. So they are diagnosing almost 3 cases a week in just one institution of cardiac amyloidosis. Whereas we at Hinduja don't seem to be picking it up because we're obviously missing the diagnosis.
Yeah.
So I think with more awakening, more understanding, and improvement in the radiologists of understanding of amyloid, this diagnosis will become very common.
So one of the very catchy point is your ECG and echo kind of if they're not matching. So ECG shows a low voltage complex and echo shows hypertrophic myocardium. So this is one catch. One should be getting alerted about this entity, and those patients with refractory heart failure. One study showed 15% of aortic stenosis patient they are basically cardiac amyloidosis, and 28 to 30% of HFpEF patients might have cardiac amyloidosis. So you're very right in saying if we look for this, we get cardiac amyloidosis as well. Dr. Kalyan,
Good.
what about in your hospital about amyloidosis awareness and picking up these patients?
We don't have, we have not received any patient from amyloidosis.
Okay. So if you are into diagnosing these patients only, then you can pick up. Otherwise, you will keep this patient on diuretics, and patient will do well, and all of a sudden cardiac arrhythmia can happen and they can die.